Maureen O'Sullivan on behalf of Independence for Change.
Margaret, I think as Taoiseach, but also coming from your own medical background, that you will agree that we need, first of all, a sustainable model of medicine development and also a sustainable model of medicine procurement. We're seeing great advances in drug treatment for life-threatening illnesses and also for the non-communicable illnesses, but what we're also seeing is a massive escalation of prices by the pharmaceutical companies and extortionate prices, and we've many examples of that, so I'll just give one. Of the overpricing. The University of Pennsylvania were able to produce a new treatment for cancer, CAR-T, at $15,000. Novartis are doing it for $475,000. And we know here what's been happening with Orkambi and Spinraza and Pembro. DNDi, which is Drugs for Neglected Services Initiative based in Geneva but offices around the world, they were able to come up with a plan using certain drugs for $150 million, but Big Pharma has said it would cost $2.5 billion to do the same. And we're also seeing that Ireland is falling behind other European countries when it comes to access to medicines for illnesses like MS. But opposition is growing to this monopoly that the pharma companies have. And just last weekend there was a lawsuit of over 40 US states against pharma companies for overpricing for cancer and diabetes drugs. Now, if we look at the base level of development of these drugs, the research is carried out by publicly funded universities and research institutes. And we know that phenomenal work is going on. But then the patents for the drugs are sold on to the pharmaceutical companies, and it's at that point that reform is needed, that our universities and research institutions are supported in challenging the pharma companies so that conditions are attached for the future affordability of medicine, so that we're not overpaying prices for medicines that were originally developed with public funds. The University College London have done a serious amount of work on this. In 2016, the EU Council passed some very strong recommendations for this kind of reform, but that needs to be implemented now with a coordination mechanism, and I'm asking, can Ireland be involved in that? I'm also asking that Ireland, as was called for at a recent Access to Medicines conference, will support the Italian resolution on transparency on this matter at the World Health Assembly in Geneva next week. Now, however bad it is here on this prohibitive cost of medicines, we can only imagine what it's like in the global south, and not even for the difficult illnesses, but also for the non-communicable ones, certain very basic illnesses that people are dying from. Sustainable Development Goal 3 is about access to affordable medicines. And we also did sign a UN agreement last year with an explicit commitment to promote increased access to affordable, safe, effective and quality medicines. So I'm asking that you will consider three aspects. First of all, capacity building, strengthening of the universities and research institutes when they are negotiating with the pharma companies who are driven by shareholder profit. Secondly, that we can retain some drugs in the public ownership, fully developed and distributed through the public health system. And that model exists in both Cuba and Brazil and in parts of the United States. And thirdly, that when the patents expire, that the government has a procurement policy that actively and timely will take up the less expensive biosimilar alternatives. Otherwise, we're just going to keep on paying over the price for medicines that are badly needed.
Taoiseach.
I just want to thank Deputy Sullivan for raising this very important issue, and I very much agree with her that the cost of new medicines is extremely high, and that's the case across the world. Notwithstanding that, so far this year, and it's only May, the HSE has approved 23 new medicines for use in this country and is considering a number of other applications at the moment. I think one of the most effective things we can do is to cooperate with other countries when it comes to procurement of new medicines, and just in the last year or so we formed an alliance with Belgium, the Netherlands, Luxembourg and Austria called the Benelux Arrangement, and in fact there's a meeting of that today in Dublin involving health officials from all 5 countries, really so that we can cooperate as countries when it comes to scanning the horizon for new developments and new medicines, sharing information on effectiveness and cost, and also potentially in the future tendering or procuring together so that we get a better price for our taxpayers and our citizens doing it as a group. I also think that there should be a single process at EU level for recommending whether or not new medicines are reimbursed. We already have the European Medicines Agency, and that agency can license medicines for use across the European Union, but doesn't have a role in determining whether or not they should be reimbursed and at what cost. And I feel sometimes that some of the drug companies play countries off against each other. And it's up to us as countries to stop them from doing that. And that's where I think at a European level we should do a new initiative, moving beyond a EU-wide licensing regime to an EU-wide regime when it comes to determining which medicines should be reimbursed and what a fair price is for health systems to pay. In terms of the Italian resolution that you mentioned, I haven't seen that, but I will ask the Minister for Health to contact you directly on that as to whether we're in a position to support it. And I absolutely agree that we need to make better use of biosimilars, and that when drugs that are on patent come off patent, we should be using the generics rather than the branded item. And those savings that can be created should be then retained in the budget to fund new medicines.
Taoiseach, Deputy O'Sullivan.
Is the extortionate price for medicines, and also the reality is the demand for medicines. And we had the awful reality where people with the same life-threatening illness being treated differently, those who are insured and those who are not insured. And it's terrible for officials and doctors to have to weigh up the cost of medicine vis-à-vis the cost of a life, whose life means more and therefore gets the more expensive medicine. You know, and it can't be a competition between, OK, this drug is going to prolong a life for 10 months, but this other drug will prolong it for 24 months, so which one do we go for? Because it should be equal access for everybody. So a different approach is needed to the pharma companies at EU level, at UN level, and also nationally. And I do think if there was a working group here, because there are practical suggestions being made that are achievable. Yes, the pharma companies provide jobs and corporate taxes, so they're giving with one hand, but what's the point if they're taking back with the other hand by costing Ireland and other countries so much more for medicines that should be and can be much, much more reasonable? So there is a more progressive model of research and development that's committed to access and affordability, and I think that's what we need to pursue.
Thank you.